So defining community-based participatory research. Community-based participatory research is a partnership approach to research that equitably, and I cannot say that hard enough, equitably involves community members, organizational representatives, and academic researchers in all aspects of the research process. And I think for community members, this is probably the one thing that we certainly hold any university or academic partners to. When you asked earlier about, the stipend, even though the stipend is not a lot, it says a lot to a partner that you really do value whatever it is that we bring to the table. So that kind of helps with the whole equitable involvement. But even with the research design, and we've had researchers come to us a number of times, I won't say from what university, just saying, hey, this is what we're going to do, and we want to use your name. And that's not equity. That's not equity at all. That is you telling us what you want. It also enables all partners to contribute expertise with shared responsibility and ownership. It enhances understanding of a given phenomenon, and it integrates knowledge gained with action. And for, again, for community members, this is also extremely important. So you've done the research, now what? We need to know, will there be an intervention? What can we, if the university isn't going to do an intervention, what can we then do with the data that's been collected and contributed or attributed to this research? And then, how can we make some sort of action plan behind that? While every single CBPR project may not involve an intervention, there is a commitment to feeding back the data, jointly interpreting the data and disseminating the data. Okay? And ultimately, this approach to research is about affecting change to improve the health and well-being of the communities involved. Now, community-based participatory research there is a distinction between community-based participatory research and community-placed research, or community-based or placed research. With community-based participatory research, that means that you are conducting research that recognizes community as a social and cultural entity. And there's active engagement and influence of community members. With community-placed research, conducting research in a community as a place or setting, limited, if any, community involvement, and primarily a researcher-driven endeavor. Okay.
Are there any questions regarding the terms or the CBPR? Yes, ma'am.
The only term that I still miss in your presentation is sustainability. It seems that what you're doing is really the issue of sustainability.
Right, and that's translating the data into interventions and our policies that will become more sustainable efforts. And some of, as the URC projects, some of them have been sustained and some of them have not over time. And there's both, ways to engage the community in making sure that those are sustained. One way that we do that is by training a lot of community health workers. And community health workers are often engaged and trained, and Yolanda has been very involved with the village health workers and can talk about the village health workers and community health workers in detail. But the engagement and training of community health workers in the process while we're conducting the research allows for some of that sustainability to be built into the communities. And that is one of the primary methods that we've used through the URC in promoting sustainability. We've also done a lot of training of community members in actual research processes, so collection of data and other. And many of the community members who go through these trainings actually have worked with us for a long period of time, like 10 plus years. So there is some sustainability as far as employment, sustainability as far as programs in place as well. So but we also have not sustained others that we really wanted to make sure that they were sustainable, initiatives, but they did not turn out to be. So, and we continue to work with partners in finding ways to fund those, and that's important as well. Did you want to add anything?
Well, I'll just say that the Village Health Worker Partnership was one of the pilot projects the pilot project of the Detroit Urban Research Center. And since funding ended through the URC, the City of Detroit Health Department has picked up the Village Health Workers Program and continued to till this day. It started in '92 and they continue the program to this day, especially in the health department moving towards a population-based modality of doing things. They understand the value of having community health workers who can go into communities and speak the same language as the community speak, and then do interventions and be more successful in their approach to different programs. So that's, like Melissa said, one example. But village health workers they're trained community leaders, and they're called upon all the time during different initiatives and as someone start a new research project, or they want to do anything from surveying to actual working as an outreach worker, they call upon village health workers.
And we also have other examples, including La Vida Project at community, it's at CHAS, which is located in Southwest Detroit, and CHAS is a federally qualified health center. So one of those pilot studies and projects did transition into sustainable program. So in looking at NIH and other foundations and support for participatory approaches, and including CBPR approach, there are increasing calls for more comprehensive and participatory approaches to research and practice. Many of the program announcements that are being released by NIH now include community-based participatory research approaches and list CBPR and as one mechanism for of interest. And then there are also increasing support for such partnership approaches overall. Foundations, again, are Robert Wood Johnson Foundation, Kellogg Foundation, Kresge are all very supportive of partnerships. And CBPR is one such partnership approach that will allow you to move forward in working with communities. So that's the basic overview of CBPR, and what we're going to do is look more in depth at the key principles of CBPR, which are the 8 principles. So we're going to go through these individually, and then we can also add examples of practice for each of these.
Okay, the first principle recognizes community as a unit of identity defined by a sense of identity and emotional connection, and shared norms, values, and goals, and desire to meet shared needs. And this is when I started with the Village Health Workers Program. It amazed me because, of course, I was not familiar at all with research and community-based participatory research principles. It amazed me how people defined community. And community people see themselves as a community sometimes if they live right next to each other, or they're defined by different things of race or a sexual orientation, and we'll get into that a little bit later. But that was amazing to me. So again, as we talk about paradigm shifts, it's not just on the researcher's part, because I thought if you stayed in a certain geographical area, that was your community. But it was interesting as we took on this approach to see how other people define their own community. Okay. And my notes are all messed up.
Okay.
So the key principle 2 builds on community strengths and resources such as social networks, which Melissa alluded to earlier is very, very important, faith-based groups, community-based organizations, and neighborhood groups. And again, looking at a community not just from a deficit standpoint, how many vacant houses, how many crack houses, et cetera, on your block, looking at the strengths of that community and and then recognizing and having the research recognize those strengths. Okay, and the third principle, CBPR promotes collaborative and equitable partnerships during all phases. Identification of issues and concerns, again, very important. We've said it a few times, you know, quite often researchers come into a community to save this community because they've read somewhere that this community has, you know, little horses and they don't need little horses. So they're gonna save this community when the community really want to talk about all of the abandoned cars or all of the, you know, addicted people in their community. And so whatever they try to do, again, just doesn't work. Identification of the research question. This is also important, and you may not think that the community has, or all of the partners around the table should have a voice in that, but you absolutely should. And I'm sure Melissa could attest, or she shared her story about how she had to switch from asthma to diabetes, but even in designing the question after that, it was still a very much an equitable process. Design and implementation of the data collection. This is also great. We always look and we always have debates around the table as to how things should be done and who should be doing it and where it should be done and what communities should be involved. And then the last one on this one is the interpretation, dissemination, and translation of findings. And quite often, this leads to some great discussion. I know personally for me, I learn a lot because I can look at a set of information and I interpret it one way and then talk to Melissa or Robert or anyone on the URC board and they see it a completely different way. So it starts a great dialogue on, you know, how things are interpreted and then where does it go from there? Who gets to read about it? Is it in the journals or in the, who's writing the article? Are we presenting? And that process involves everyone at the table, and I'm doing this for table, guys. So everyone at the table, and it involves everyone having an equitable or an opportunity to present and or be a part of, be an author on a paper or an article or anything like that. So it creates an empowering process for making decisions and sharing resources equitably. And key principle 4, facilitates co-learning and capacity building. Again, what I've just mentioned in terms of how we learn from researchers and researchers learn from us. It involves teaching and learning among all the partners because everybody comes to the table with something.
Key principle number 5, balances research and action for mutual benefit of all partners. So the CBPR partnerships commit to translation of research findings to action, as we've mentioned, and may directly include an intervention or policy change component. Not all of our research through the URC includes an intervention component. A lot of it is based on policy, and lately we've also been working on health impact assessments and looking at how we can engage policymakers or influence policy change. Key principle number 6 focuses on determinants of health from a local standpoint within an ecological approach. So we understand that it emphasizes an understanding that a community has a unique context, the cultural context, historical, political, and socio-economic, and all of those are taken into account as we move forward. Also understanding that individuals are embedded within a broader ecological context of family. How does family influence behavior? Specific age groups are also influenced very much. If we're targeting change in a young child who is 5 to 12 years of age, that intervention should be focused not only, maybe it's a multi-level intervention, looking at the child, providing education for the child, whether it be asthma management or other, the caregiver related to asthma management, and the physician, and how to better communicate. So the practitioner as well, and how to communicate with a family. The social network is taken into account, as well as the community setting, the resources and assets within the community, and society as a whole. Right now in Southeast Michigan, one of the factors that is impacting a lot of health and stress specifically is the economic situation and unemployment.